When you last saw your GP, was it in person or online? For me, it was online, and more of us are now seeing the doctor from the comfort of our own homes, sometimes through a computer, then on the phone. New figures released today show remote appointments have hit the highest level since the pandemic.
A third of all GP consultations in June were done virtually. So is this a good thing? Is this an effective way to treat patients, or is it leading to potential harm? We're going to talk about that now. And joining us is NHS GP Dr. Murray Ellender, who's head of healthcare at a digital health company, and says virtual appointments are safe. And broadcaster and mother of four, Danny Nichols, thinks these sessions are a disaster waiting to happen. Let's come to you first of all, Danny. You think there's a potential problem. What's your experience and why do you fear that?
Because I think the phone consultations were forced on us during COVID, and I think that was quite convenient that we kind of said, right, we can't go into the doctor, so this is what we're going to do. And that was accelerated, I think, too fast. And I don't know about you, as a mother of four with elderly relatives who are unwell, I haven't seen anything good about it. In fact, it's not made it any easier to access appointments for us as a family. A relative of mine was actually diagnosed with chronic kidney disease via a video of one of the GPs in the surgery. I just think that's actually quite awful, and especially for a generation. This might be an easier thing for the younger generation. I see in my children that they cope with things like this a lot better, but we still do have a whole generation of people we're assuming have access to the internet. We're assuming they can use these facilities. And I mean, sometimes it's hard enough to get, you know, especially someone like my dad or whatever, to try and get him to follow up an appointment or I think it's just another case of a disaster waiting to happen.
So what do you fear will be missed? What is your fear that it could be a risk?
I feel we've already got the biggest numbers of people coming out of school and young people and not going into work with mental health issues. That's already at a crisis level. We know that. I think this will exacerbate that even more.
Because they won't see the problem that's behind the reason for them coming in.
No, I've got a friend who when she had a young baby, she went to the doctors over a check of some kind, I think. She was getting some pain or something. And then she ended up being diagnosed with postnatal depression.
Right.
And she did not go in for a diagnosis of postnatal depression. She thought it was normal to feel so lonely and isolated. And I just think this society is just gearing up more and more to isolating people.
Dr. Ellender, so we heard from Danny there. She's worried about old people who find it hard to do things, you know, in a different way. Young people who may have mental health issues. My worry is this. I said, you know, for someone like me, it's great, a GP consultant because it's really convenient, busy lives, lots of parents. My worry is, and I remember from my time as a Member of Parliament as well, when you have a surgery appointment, you talk to people about the thing they say they've come in for, and at the end of the time, they say, oh, by the way, another thing. And that's when you find out why they really came to see you. And in a GP surgery, people are a bit wary of coming in and saying what they are worried about, but then they reveal it to you in person, or you can spot it. Whereas online, they're unlikely to write down what they really are worried about. On the phone, at a distance, you can't see them in the same way.
No facial signals.
Isn't there a danger as a GP that, for lots of people, it might be really convenient, but you miss the really hard cases, which are the ones where you can make the most impact?
I mean, let's not forget that actually the NHS is really struggling, and we're now seeing a lot more patients as an NHS because we've introduced things like remote appointments. So actually, it is improved access to the health system because actually we're coping with a lot...
Not in Danny's experience.
But we're
it's still a struggle for a lot of people to get the same appointments.
It is, but if you think back to that struggle to get through on the phone at 8 o'clock in the morning, you know, a queue, 40 minutes, and then you're offered an appointment face-to-face 3 weeks next Tuesday, that's not great. Whereas actually with a remote consultation, you can get something seen and dealt with that same day. I think to your point on mental health, I think that's it's a fair point. But actually what we see in practice is that a lot more patients are more comfortable revealing stuff online, especially that younger population you talk of. A 22-year-old man with anxiety, it's a massive hurdle to go and sit in front of a GP.
The detective work that you have to do as a GP on the phone or online, as opposed to being in the room with them and seeing how they're behaving and how they are kind of communicating in a non-verbal way?
I think that's the skill. That's what we're all trained to do as GPs, is pick up when this patient
You were
does
trained to do it in person. You weren't trained to do it on the phone.
No, but we've since learnt very well how to do it on phone and online. I've been doing phone appointments for 20 years. And actually, it's that sense of knowing when a patient should be brought into the surgery and be seen, I think. But actually, if we were to stick with the old system and try and get everyone seen face-to-face, the system would crumble. We'd never cope.
So it's a practical reality that makes it more efficient. The evolution of it in terms of the convenience of appointments can be very challenging, because what you do is you're waiting for the phone call back.
Yeah.
And there's no way of
They never ring when they say they're going to ring.
Never ring when it's going to happen.
We're busy.
Rings
I
from
know,
a
but
withheld
we're busy
number.
too.
You can't then return the call.
Yeah.
You have to go back and do
Agreed.
it. So there definitely needs to be some improvement there for the people it suits. Is that on the cards?
Yeah, for sure. I think, and actually having tools like, the ability to specify a much tighter time window when you're going to get a call back, or actually being able to have a completely asynchronous consultation. So you think how we interact.
What does that mean?
So we interact in every other bit of our life through messaging. Actually, I might message you. So for something simple, actually, if it's just a flare-up of someone's eczema, I don't need to speak to you about that. That could be dealt with by a message back to you saying, actually, I've got your medical record, I've reviewed the photos you sent in, and now I've sent a prescription. Yeah, a voice note, or I've just send a message. I've sent a prescription to your local
What you want is the phone not to say unknown number as well.
Absolutely.
If it says unknown number, you don't
That's
answer
critical.
it.
Agreed. So
It needs to say, this is the doctor calling.
Yeah, absolutely.
Absolutely. I think it's really sad, because I think it's open to a massive amount of problems within what can go wrong. And as a...
Danny, be honest, aren't you sometimes tempted, though? Wouldn't it be quicker and easier for you just to do it on the phone?
I know, but is that us deciding what we should and shouldn't have? And
For
what
convenience.
and that is what worries me.
Well, you'll
because
worry.
We're becoming the doctor, aren't we? We're deciding which... and I know we're not idiots, and there's elements of that where, it's a flare-up of this or a recurrence of that. We do know that. Are we not slipping into a world where we're going to become the doctors?
No,
Yeah.
I think there definitely should be choice, right? So actually that's the system. If it works well, it should offer a choice. So you should have a choice of phone, face-to-face or online appointments. That's when the system would work well.
Really interesting.
I agree.
OK. Should we end with agreement? and the fact it's work in process. We've got a statement from the Department for Health and Social Care. They say the government has recruited more than 2,000 GPs in the last year and provided an extra 7 million GP appointments. They're transforming the NHS app to make managing healthcare online easy and flexible, so people who do prefer face-to-face appointments can get one. So
I'm not sure that totally answered the question. I think Dr. Ellen did a better job than the health department there, don't you?
OK. You may say that, Minister. I can't possibly comment. We asked you if you think virtual GP appointments are safe. Should we see what you think? 31% of you said yes, they are, but 69% believe they can be risky. So work to be done to make people feel comfortable
that was really helpful.
in all ways.